Hello lovely people, today we're talking about back pain. I've had back pain for about 20 years, so I've had to learn how to manage that. And here are some of the mobility exercises that I do when I have a flare-up. Lying on your back to start with. Obviously you can have a cushion or a pillow under your head if that's also uncomfortable. Feet hip width apart. And before we start, often when people have back pain, well, always when people have back pain, they tend to be bracing in some way around this thorax or thorax and lower back area, even upper back as well. So we're going to start with some breathing. So I want you to put one hand onto your breastbone, one hand onto your rib cage, and I want you to breathe into the rib cage through your nose, just gently. See if you can get the rib cage to expand. And as you breathe out, let go. So we're trying to do less up here and more here. So this should barely be moving, but the rib cage should be widening. The belly should be widening a little. And then let go. Let everything sink down and relax. So breathe in. Breathe out. Let go. Breathe in. Breathe out. Let go. One more. Breathe in. And breathe out, let go. Close your eyes if you need to, if it makes it easier. And then as you breathe out, I want you to feel that you're sinking the back down into the floor, shoulder blades, middle of the back, lower back. And just connect with that sensation of relaxing and letting the muscles relax. You might have to do it for a while. If your back's quite stiff and tense, you might want to pause the video and just focus on that soft breathing in and that soft breathing out and letting all these muscles relax on the out breath. Have a go, practice, and you will find that it helps to relax the muscles. We're next going to bring the right knee into the chest, breathing into the lower back. As you breathe out, let go of those muscles. And again, breathe in. Feel the lower back expanding, breathe out, let go. One more, breathe in. And breathe out. Let go, switch legs. Breathing in, so rib cage expands, lower back expands. Breathe out, let go. Breathe in. And breathe out. One more, breathe in. And breathe out. Bend the knees and just let the knees travel gently side to side. See if you can keep everything else relaxed. See if you can keep your shoulders relaxed, your neck relaxed, your jaw relaxed, your back relaxed. One more on each side. And then we're going to come into some little pelvic tilts. So we're just arching the back away from the floor and then tipping towards the floor. Arching and tipping, arching and tipping, arching and tipping. And on the next one, we're going to arch, tip, keep the tip towards the floor. Make sure the feet are about hip width apart and the feet are firmly pressing down. And then roll gently up through the spine. Rolling up, rolling up, rolling up. All the way to the shoulder blades. Breathing in at the top. And as you breathe out, roll slowly back down. Now, if you're having a flare-up of back pain, you might not go as far up as I'm going. You might be able to do the pelvic tilt. You might come up halfway. Just do what you can with the breath. Breathing in, breathing out. Breathing in and breathing out as you come up and down. Nice. You're just going to bring the right knee onto the left, or the right foot onto the left knee rather, not the knee onto the foot. And you're just going to let that knee drop out there. If you want to, you could take the hands behind the opposite thigh, just to try and stretch out this hip area. If that's a bit too much, you could just lie like so and just breathing in and out here for a couple of breaths. So trying to stretch out this hip, which invariably will be quite tight alongside the back. And then switch sides. So either just staying put like so, breathing in and out. Or if you want to increase the stretch you get, you could bring that knee in, that thigh in towards you. I'm getting my body parts mixed up, as always. And release. And then just bringing that foot back down and just gently rocking from side to side again. Nice. Okay, so we're going to roll onto the side gently and slowly, and then you're going to come up into this kneeling position, feet hip width apart. If you can sit like so without it being too uncomfortable, you can just take your hand and press it to the floor and lift and lengthen your spine up. Bring the left hand onto the right knee, the right hand behind. Breathe in. As you breathe out, you're going to really gently rotate the rib cage, not the lower back, just the middle of the ribs, just rotating gently towards the right. Then switch sides. Right hand onto the left knee, left hand behind. Lift up and lengthen from the lower back. Breathe in. As you breathe out, rotate the rib cage really gently to the left side. And release. Coming onto all fours. We're just going to circle the hips round in one direction. Just trying to relax the pelvis and the back muscles. And then go round the other way. Nice. And then come back to the centre. Try and tuck under here at the pelvis. Just this lower back. See if you can tuck under. So it's a bit like the pelvic tilt we did lying on our back. And this might feel quite uncomfortable, quite sore, but you're not doing any damage to yourself. You're just getting the muscles and the joints moving. So just tucking under and then seeing if you can keep that tuck under and then just rock forward and back a few times. Rock forward and back a few times. That's it, with the breath. Breathing in and breathing out. Keep the tuck, feel the stretch. Rock forward and back. Come back to the centre. Take the hands to the left. Left hand, right hand on top. Bum cheek to the right. Come down into this wide-legged child's pose position. You might not get as far as I am going. You might be up here. But just see if you can feel that stretch coming down the side of the back there. Come back up. We're not staying there long. Right hand, left hand on top. Bum cheek to the left. Stretching down the left side. And maybe repeat once more on each side. Breathing in, breathing out. Other side. Breathing in and breathing out. And then you might want to get a cushion to put under your head. You might want a cushion under your bum. So you can come into this position and just have a little rock from side to side. Mobilising the hips. Nice. Coming up to all fours. Bringing the left foot forward. See if you can tuck under a little at the pelvis here. And then just rock forward and back a few times to stretch the front of the hip. And then switch legs, holding onto something if you need to, tucking under at the pelvis, and then just rocking gently forward, not creating tension into the back. So you go a little way if that is better for you. And then release. And then we're going to come down onto the tummy. Place your head onto your hands, and again just rocking the pelvis from side to side. And then press your pubic bone down towards the floor. Just maybe slide the bum cheeks down towards your heels so that your bum fires up a little bit. Place the elbows in front of you and see if you can lift up the upper back only. Rib cage up. Press the elbows down. See if you can get a little bit of a lift through the spine. Keep the chin down. If it creates too much tension or pain into the lower back, just come down onto your hands and rock. Or see if you could press the pubic bone down a little more, the tailbone down towards the heels a bit more, and see if that takes the strain away. So do what works for you. And then release. Come back up to all fours. Just sit back on your heels again. Breathing in and out. And then slowly come up into sitting. So have a go, just those few stretches and mobility movements, and see if it helps your flare up. Try and move regularly, at least every 20 minutes during a flare up. Just not sitting in one position can be really helpful, and moving gently also really helpful. Hope you feel better soon.